But now I think it's time to begin. So, welcome everyone is joining us today. I'm so happy that you're here. So, today we're going to be talking about building the future of youth behavioral health and launching child and adolescent programs that meet urgent community needs. So, let's get right into it. So, before we begin today, I do want to make a few disclaimers. One, this webinar will be recorded. We just do want to make it available for people who aren't able to join us today. So, it will be recorded, the chat, messages. So, just want to let you know that. If you have any questions pertaining to this webinar, feel free to drop them in the chat. We will have a Q&A section and we'll try to get to some questions at the end for any questions you have. So if you could save for that time, we'll happy to try to answer them. And then we'll have some polls during the session. We want it to be interactive and help everyone learn. So we'll be asking some questions, and so you could be on the lookout for the questions and provide your answer in the chat box. So, a little bit about ClearPath Consulting Group. We have over 40 years of experience, and we specialize in helping new and existing providers get licensed and then manage their programs successfully. So, we do licensure support. We'll help you through the process of that. We develop policies and procedures, and we're really proficient in compliance. We think it's one of the most essential parts of running a program, especially in human services. So those are our focuses here at ClearPath, and we just want to make it easy and seamless for providers. We're CHAP certified consultants, and so we're really proficient in what we do, and we're also a family-run business, so over 40 years of experience. So this is just an overview of some of our experience. It dates back to 1992. We've run assisted living facilities as a company, Medicaid transport. We've had various group homes and behavioral health group homes, mental health group homes. And even today, we're providers, residential providers. So we're experienced in the field. We know what's needed, especially when it comes to pursuing licensure. And we really specialize in child and adolescent programs, as well as DD and elderly. So I just want to introduce ourselves as your facilitators today. I'll start with myself. I'm a certified trauma-informed practitioner. I'm also a residential provider at Faith Enlightens. And I'm also the founder of Faith Enlightens Self-Love Academy. Where we forward self-worth education and we make it accessible for behavior health providers such as yourselves. So we provide plug-and-play systems aligned with SEL and based in cognitive therapy. So feel free to check us out. And I'm also the child and adolescent program consultant here at ClearPath. We also have Miss Mohammed. Miss Mohammed, feel free to introduce yourself.
Hello, excuse me. I was monitoring the chat in the waiting room. Yes, my name is Talia Muhammad. I am the lead consultant here at ClearPath Consulting Group. I am a CHAP certified clinical manager and a CHAP certified consultant. I also work with companies and providers all around the US and work as their chief compliance and QA officer. So very happy to, be on this call. And Faith is a wonderful youth and adolescent, development program development manager here. So happy to be here and to support this initiative.
Yes, I'm very passionate about positive youth development and particularly developing programs that contribute. So we're going to be learning a lot today. I do want you guys, this is going to be a lot of information. So if you have a notepad, you have a pen, you may want to jot some things down, just have that available because we will be talking about a lot today. So this is what you can expect to learn today. We're going to talk about why youth behavioral health services are an urgent need in the United States today. We're going to talk about what that urgent need means for providers. We're also going to talk about some high need services in some priority states for youth and adolescent services. We're going to talk about the general steps to pursue licensure. And then we're going to talk about why some providers actually struggle after licensure. And then we're going to talk about how ClearPath supports providers. And then at the end is super exciting. We have some program options. And next step for providers who are interested in urgently serving child and adolescents populations in the United States. We have some exciting new offerings. But before we begin, I do want to ask you all, what child and adolescent programs are you most interested in learning about today? Feel free to drop a message in the chat.
So I did see a couple of messages in the chat. We have someone asking about programs for adults 21 years and up, and we do service those program types. And then also mentorship and skills training programs, and you'll be happy to know that we'll be covering that today in
Yes.
so
Awesome. And I do see some people enter the waiting room. If we could let them join in.
awesome.
So there is currently a behavioral health youth crisis in the United States. It actually was reported that 1 in 3 adolescents, which is a grand total of 31%, report experiencing advanced mental, behavioral, and emotional issues. And that was from the National Survey of Children's Health. So it's a rising issue. We're also seeing an increased emergency room visits from children for mental health reasons. So they're being admitted and they're waiting in the rooms and it's time for discharge, and they're finding a shortage of beds. They're finding a shortage of child and adolescent psychiatrists, mental health programs, and other services to continue their care. And so the states are seeing this increased need and this growing crisis, and they're actively searching for providers to meet this need. So this is what we're seeing. There's not enough residential providers, not enough community-based services. So there are some national trends that we've been seeing the past 10 years. So this is not a new issue. The behavioral health needs have been rising for over a decade amongst children and youth. And there's many reasons for that, and we'll go into that later. But they report that 1 in 6 youth have a mental health condition, but only half actually receive services. And so states are noticing this disparity. And so they're actively pushing and making policies, and we'll talk about the different programs that they're initiating to make services more accessible for these youth. In 2023, 40% of high school students reported persistent sadness and hopelessness, and 20% of those seriously considered suicide. And so there's many factors, again, that play into this trend, but it's been rising, and hospital beds are not able to accommodate for these emergency mental health visits amongst the youth. So why is this crisis happening? There's many reasons and they all play a part, but firstly is the increased social media and digital exposure. This generation of children is more exposed digitally and socially than any generation before. And I'm sure you guys see that in your work as providers or maybe in your own children. They have so much access to information, access to crises all over the nation. And it can also lead to comparison, self-esteem issues. All of those things with that increased exposure is affecting mental health in the youth. Another thing is the COVID-19 pandemic created a lasting effect. Um, a lot of the children, a lot of the youth and teenagers specifically during this time, those were critical developmental years where they had limited social interaction. I also did a study in school about the literacy rates, and how badly COVID-19 affected them. And it also affected children socially and mentally. So we see that still having a lasting effect. Actually, during COVID, the mental health conditions amongst youth reached an all-time high. And ever since then, it's never returned. It's remained high. Another factor that's contributing to this crisis is economic and systemic stressors. With housing instability, the costs of living are constantly rising. I know you guys see that for yourselves. A lot of food insecurity is happening. And these things are causing mental health stressors on not only the youth, but their families. And it also is causing a gap between receiving care, that preventative care. Youth may be struggling, but they see their caregivers, they see their parents struggling, and they don't have they don't want to burden them further. And so that then creates prolonged conditions. And the final reason that is really important to address is that now in 2026, we have increased awareness. So in previous generations, certain behaviors in youth and adolescents, when they may be labeled as juvenile delinquency, are now being recognized as behavioral and mental health conditions. And so you can see that now, especially in the mental health and behavioral health care field, there's an increased need for trauma-informed care, evidence-based approaches when it comes to youth. And they're now having an awareness to recognize these issues as the behavioral health conditions that they are. So, what does this crisis mean for providers? Well, it means two things. You have an opportunity and you also have a responsibility. So, states are actively seeking qualified youth care providers, specifically doing that trauma-informed care that we talked about. So, states, there's an urgent need, but also an urgent responsibility. When you're caring for this vulnerable population, we always like to say, and Miss Muhammad, when she does her work with her consultants as well, she drives this in. Think about if it was your child that was having a mental health crisis and they needed support. What kind of service, what kind of providers would you want them to encounter and seek help from? So it's a responsibility to make sure you're competent, make sure you care, make sure that you are compliant, and also effective. So this can look like higher review timelines. So if you're looking to provide a specific service, states are saying, hey, we urgently need this service. So our previous review times may have been this time frame, but we're now processing applications and licensure at a quicker rate. We're seeing this in various states, and we're going to talk about that a little bit later, the specific states we have for you guys. But we're seeing a quicker review timeline and priority rankings. This also includes increased Medicaid funded services. So states are seeing that, the youth, there's an economic disparity. So they're saying, hey, a lot of this youth, they are under Medicaid. So Medicaid is coming up with programs that make access, increase accessibility, excuse me. Ohio actually has a program called Ohio Resilience. And that's when they're doing exactly that. They're expanding access, they're connecting youth and their caregivers to providers in the community. And so they're really just attempting to make it easier and lower these rates in this crisis. This also means long-term sustainability. If you build your programs correctly, compliantly, and structured properly, you could have long-term success in your behavioral health business. So these are what the states are actively seeking nationwide. Now, for each state that is in a crisis, there are specific services that they're looking toward, and they are very vocal about the specific services that they need. But nationwide, this is what they're actively seeking overall. So, transition age youth programs, they're looking for community-based supports, family caregiver supports, and school-based mental health. So, transition age youth programs would be programs serving foster care youth. So, what they're seeing across the United States is that youth that are in foster care, maybe they were in foster homes and receiving those supports as a child, they're aging out of care and they're reaching those ages like 18, 19, and they're kind of just left to fend for themselves. And a lot of them don't have that family system or that strong support system to help them navigate adulthood. So they're seeking providers to help with this vulnerable population. And that could look like independent living programs where you help them and you teach them those skills like money management, career readiness, how to get a job, how to handle their medications, book their appointments, just giving them those foundational life skills. And there's different services you can do to provide that. Community-based supports is a great effort that nationwide I'm personally seeing in my consultancy that every state is seeking. So again, they do need residential when it comes to psychiatric facilities, behavioral health centers. There's some urgent needs for that as well. But they're wanting to keep youth also in the community. They essentially want to make them active members and positive members of the community. So they're seeking supports that can meet them where they are, whether that be group homes in the community, whether that be crisis response, whether that be going into the home and doing that mental health skill building, that mentorship that someone else spoke about earlier. So they're seeking those supports, meeting them where they are in the community, trying to rehabilitate them without taking them and institutionalizing them. And something else that they're looking for is family caregiver support. So that again leans into that going in the home, maybe for the developmental disability youth population, helping them with that personal care. Anything that can assist their caregivers in supporting the youth in the home, they're looking for that. That could be taking them out into the community, helping them do workshops with them. It can look like various supports. And also a big one is school-based mental health services. Again, they're noticing a huge disparity. Youth are not seeking the support that they need because of economic, financial reasons, and also a stigma around mental health that there is. And so they want to go and meet them where they are in the youth, and with school-based mental health services. And that could look like a variety of things. That could look like providing therapy in the home, in the school, excuse me. And then that also looks like crisis response. So mobile crisis response. So if there's a crisis happening at the school, having a mental health crisis response team coming in, de-escalating that student, helping them. And so these are the states generally that we're seeing that across the nation are needed. So these are some states with some high current need that have clearly identified and expressed the specific services that they need. Again, there's way more states than this that have a high urgent need, but these are the states that say, hey, we have this need. We have initiatives to support filling this need, filling the gaps, and they've actually expressed the particular services that they're interested in. So we have Maryland. Maryland is specifically looking to reduce the juvenile incarceration rate. So what they're saying is, hey, we have a high juvenile incarceration rate, and they found that over 70% of the juveniles in juvenile detention there are having severe behavioral health conditions. So they're saying, hey, we want to provide more support to the youth. So they're looking for community-based supports, specifically mobile crisis response within the community. So they want to be able to, you meet the youth in their community, whether it be at their homes, whether it be at their schools, and de-escalate, intervene during those crises. They're also looking for targeted case management. So managing these youth, helping them connect to services, they're looking for that as well. And they're also looking for residential services. So that could look like group homes, therapeutic group homes, residential treatment centers. They want to have that community-based support, and you'll see that across the rest of the states as well. Virginia is very clear about what they need. One thing that Virginia is needing is mental health therapeutic group homes for children and adolescents. They've been very vocal about this for the past few years, actually. There's been an increased need in various counties in Virginia. And so Virginia in particular is very special, and this is why we're kind of focused in this area at ClearPath right now. They have something called a priority service listing. And so they'll tell you they have a ranking for mental health group homes, and it's a high service ranking, and they'll process applications in a quicker time frame, which I mentioned earlier. Florida has an increased need. They're looking for inpatient excuse me, intensive outpatient services, and partial hospitalization services. So again, they don't want to institutionalize the children. They want them to be able to remain in their homes while still receiving those high levels of care that they need. So intensive outpatient, that could look like being in a center, and they come and have programs throughout the week, and a structured programming. And they come a few times a week and they're able to get that programming, get that therapy, and they can return to their homes at night. The partial hospitalization is more in a hospital setting, and it's doing that as well. It's just a lot of programming throughout the day. The children are there, they're getting that service that they need, the programming that they need, and they're able to return to their homes. So it's just an initiative to, again, give them the high needs services that they need and make it more accessible. Georgia is looking for the same. They also need some more substance abuse services for children and adolescents. They need assistance with that, and that can look like residential group homes. It can look like going in the home and giving that skill building, that variety of services. And then Texas has a huge need, which is the same as Florida. They're also looking for intensive outpatient and partial hospitalization. And Texas is in specifically, they are in an urgent crisis. One in three of their children and adolescents have advanced behavioral, emotional, and mental conditions that need addressing, but only half of those children are actually receiving services. So they have a Medicaid funded program for that as well. And they're really driving to find service providers. So those are the states that are actively seeking providers like yourself with children and adolescent services. Ms. Mohammed also um, had some notes about this. Ms. Mohammed, if you had any things that I missed or you wanted to add to this before I move on, if not, I'm free to move to the next slide.
Yeah, I just wanted to mention that we have compiled a list in every state of the specific services. So again, as Faith mentioned, these services are priority, which means the processing times for applications are expedited. And they really need providers. So we'll be telling you guys how you can access that list a little bit later on in this webinar. But just again, take your notes. And when you get to that list, kindly just, copy the name of the program and research it for yourself and see everything that you would be responsible for providing for this particular service. Because not only are we interested in opening up profitable programs, but we're also interested in filling the gap in the need and being responsible providers. So that's all I wanted to add there.
Thank you. I do want to mention in Georgia, they're also seeking DD providers, residential providers, excuse me. So they need some more group homes for children and adolescents with developmental disabilities. So they're seeking that as well. So, opening a youth program is a process, and it includes various steps. But at ClearPath, we kind of put it into four. One, you need planning, you need structure, you need compliance, and you need ongoing systems to maintain success of your program. This is what we're seeing throughout our work, and we're going to get into the specifics of each one. So, we're going to talk about the licensure process and what it looks like generally across the services and states. Again, it's a little different for particular states or particular services in those states, but this is generally what each licensure process looks like, especially for children and adolescent programs. But before we begin, I do want to ask, what part of the licensure process holds you back or makes you a bit apprehensive the most? Is it the actual process of applying? Is it developing your policies? Is it the financial aspects? What's something that, as a provider or as a interested provider, what's something that kind of holds you back a little bit? We do want to know.
Good afternoon. My name is Courtney. We
Hi,
have an
Courtney.
agency. My husband and I have an agency in Virginia, and we serve children and adolescents. But for us, it would definitely be policies and procedures.
100%. Nice to meet you, Courtney. Thank you for sharing that. Yeah, we find that often it's the policies, and that's definitely a fair apprehension because the process can be a little bit difficult or complicated depending on the state. Reading those regulations, then understanding them, then developing a process to address them in your policies. So we definitely see that a lot with our clients as well, and we like to make it easy, so we provide some processes to help with that. Was there anything else that you guys, anyone else, something that you struggle with or something that holds you back with licensure?
Yes, I did make a comment. I said this MNK, uh, like what are the red tapes and like what's the time frame for from application to approval? Because these are some of the things that you apply and you have to wait like 2 years. By that time, you might get involved with other things and then you know.
So if,
Thank you for,
sorry,
sorry.
go ahead.
No, go ahead, Miss Mohammed. This is right up your alley.
Yeah, so if I just wanted to mention, oh, so you said red tapes. So that does vary by state. And a lot of the states that have priority right now are some of the southern states. So, with that being said, there's a lot of bureaucracy and there's a lot of red tapes. We're familiar with, where that lies. Virginia in particular, they have a very streamlined process. So even though they are southern state and have a lot of red tapes, their process, if you follow it exactly, you can streamline and avoid the pitfalls. So overcoming red tapes in general starts with making sure that you have a surefire execution plan. And that's what we're about at ClearPath, giving you a clear path to know every step and all the tools that you need along the way to avoid those red tapes. So that's one. And then the length and the time frame for approval. Being that today we're particularly talking about priority programming, every state, they have their own processes, but we're looking generally across states at 30 to 90 days for the application approval. And that varies because it depends on if you're a residential program, and it depends on what state. So I'll just say Virginia in particular. They've broken their priority needs down into two categories, priority one and priority two. So if you're fulfilling a priority one program type, then from the time that you submit the application, it's going to take about, I think, 10 days. Please correct me if I'm wrong, Faith, for the
That's
application
correct.
review. And
Mhm.
then if it's a priority two, you're looking at about 20 days for your application to be reviewed. And then you have to get scheduled for your initial licensure visit if you're a residential program. So you're looking between 30 to maybe 60 to 90 days for approval. And that's what we're seeing across the high priority states.
Yes, and I do want to add, again, like she said, it varies by state, but that's the importance of targeting and we're going to talk about this in the licensure process, so I'm not going to get too much into it, but that's the importance of targeting states that actively express their urgent needs and priorities. Because when you do that, again, like we mentioned a little bit before, they are able, just like Virginia, to make the process shorten the timeline and increase make the process accelerated. And we see that in Virginia and we see that in a few other priority states, but it truly does vary. It depends. Does that state need that service right now? What area are you seeking to provide that service? So it truly depends on your specific service. All right, so we're going to go into the licensure process. Again, this is what it generally looks like across the states. And this is what we're seeing here at ClearPath that it's needed for every licensure process. And it could vary a little bit. So the first part is doing the research. So identify the service that you want to open. Do you want to provide a residential service? Do you want an outpatient service, perhaps in a clinic? Or do you want to provide in-home support? You need to identify the service you want to open, and identify the population that you want to serve. And you should get really specific about that and do your research, and really self-evaluate. Are you willing to accept the responsibility to not only provide this service, but serve this population? So you're saying maybe you want to serve children and adolescents. Okay, what kind of children and adolescents? You want to really do your research. Is it boys? Is it girls? What kind of needs do they have? Really do the research. And after that, you figure out your service. You need to identify a high need state or area. This is where a lot of providers mess up. They have a great idea of a beautiful program, a beautiful service, right? But their state that they're looking to open it in doesn't need it. They have a plethora of providers there. And that can lead to a lot of issues, not only with the business, but with the structure of it scaling. So you need to identify a high need service and area. So the next part to licensure is understanding the process. So now that you've identified the service, the population you want to serve, you found a high needs area, now you need to determine who licensed this service. Determine the regulatory body. Specifically with children and adolescent programs, they're generally going to be under these state departments, but it can vary. So you really need to do your research on this, but it's typically going to be under Department of Behavioral Health or Developmental Disability Services. It could be under Department of Social Services, Children and Families. So those are typically the services that these programs are under, but you should definitely um, find out the regulatory body and really get down to that. Next, you need to observe and understand the application process. So once you find the regulatory body who license, look at the application, really digest it and understand it. What are they expecting from you? What documents do they need from you? What policies they need from you? Really understand that process. And you really need to make sure you're looking under your specific service because the applications vary per service and per state. So understand those requirements. So next, now that you understand the requirements of the state, you know the regulatory body, now it's time to build the foundations. So generally, you're going to need in all states and services, you're generally going to need these things. You're going to need your policies and procedures. And again, that's very specific to the service you're providing. You're going to need a business plan. States and regulatory bodies want to see, hey, how do you plan to run your business? How do you plan to scale it? How are you going to maintain your operations? They want to see that plan. They want to see your financial projections. So, what are you thinking to make? They really want to see you take initiative and really understand that you are not only providing a service, but you're running a business. So, you're going to need those financial projections. You're also going to need a quality assurance plan. So how are you planning to maintain quality of your service? You know, you always want to be constantly improving. So you need a plan for how you plan to improve, how you plan to correct, catch issues. You need that plan. And then you also need a risk management plan. This is so important when you're serving any vulnerable population, but especially children and adolescents. How are you going to reduce risk? How are you going to maintain their safety, not only with staff, but environmentally, emotionally? You need a risk management plan to manage that risk in your business. A lot of providers stop right here. You know, they think they have the policies, the business plan, they have all these documents in place, and they think that this is the end all be all for a successful program, but this is not it. And Miss Muhammad, let me know if you ever want to add anything. I'm just on a roll here.
No, this is good stuff. So we'll talk about like risk management and quality a little bit later, but so important.
Yes, it definitely is. So, after you develop your fundamentals and you got your policies, you have your documents, now it's time to select a site. Now it looks different. It depends if you're developing a residential service or you're doing a non-residential service. For residential services, before you can apply, especially in a priority state, you need to identify a property and ensure proper zoning approval. So you need to find a property, and not only that, you need approval from the local county that's saying, hey, this property is able to be used for a residential program. So you need to make sure it's compliant with fire and safety, it's able to run that program. And I always like to tell providers, you need to seriously consider the population that you serve when you're looking for a site, excuse me. I'll give an example for me specifically. At Faith Enlightens Residential, we serve adolescent girls who have depression, anxiety, and self-harming behaviors. So when I'm looking for a site, I'm looking at one, the environment. So I'm looking for some light environment with a lot of light to raise those dopamine levels. I'm also being mindful of the mirrors. You know, we can't have glass mirrors. We have to replace that with something that isn't breakable. Maybe I wouldn't have a high balcony somewhere. So you really need to get into the mindset of a provider, even when you're um, looking for a property for your service. Who are you servicing? What are their risks? You need to really consider that when you're selecting a site. For non-residential programs, you're typically going to need an office, but the requirements for that office varies by state. So you need to figure out what are they requiring of your office? What are they requiring you to store there, have there? What is the purpose that they list that you should have your office for? You need to gather that and you need to find an office that meets the requirements for your state. So the next step is hiring. Before you apply, you need to hire your core management staff. So that could look like your program director, your therapists. It truly depends on the service that you're running, but whoever's in charge of core management that is essential to your program, you need to have that because you're going to need to include some documents from them on your application. So service-wide, statewide, you're going to need a background check for yourself, for your employees. They're going to want to see that. You're also going to need to submit your floor plans. Again, you need that zoning approval. They need to see what does the home look like. You're going to need to submit that with your application. You're also going to need your inspection forms, and then you're going to need you're going to need your documentation to submit with that. And the process is very state by state. And so after you've hired, you've selected your site, you've done your policies, you've done your research, you apply and prepare for your inspections. And those inspections are when you submit your application, and within a certain time frame, they'll come and examine your site or examine your office and make sure you have essential documents, you have the place prepared properly. So once you pass that exception, you're now licensed. So congratulations. At this point in the process, you're now licensed. But this is where a lot of providers start facing challenges because they think that this is the hardest hump, getting licensed. I know a lot of people are apprehensive about that whole process. So when they think in the grand scheme of things, they think that the licensure is after that, it's easy coasting. But this invokes a whole another process that we're going to get into. And right here, it's time for Miss Muhammad. She's going to get into some further issues that she's really proficient in. So I'm excited to hear her.
Awesome. Yes, so common issues after licensure. So the first thing that we notice is no referral pipeline. And marketing is very important. That comes from poor marketing strategy. The great thing about priority programs is that there is a need. There are clients who have waivers and are waiting for your service, but you also need to let them know that you exist. And the way to do that, Medicaid restricts us from marketing directly to individuals and their families, but you can let their, caseworkers, you can reach out to caseworkers, social workers, coordinators of community services, hospital discharges planners. Let them know you exist. Also, incomplete intake workflows. So you need a workflow for intaking new clients that's systematic and based on like SOPs that any program director that you hire can pick up and follow that process. Also, weak compliance tracking. We see that a lot of new providers they get into corrective actions issues because they are not properly tracking and reporting serious incidents. And so, and they don't have an internal audit process to catch weaknesses before they become larger issues. So that's one thing. And then incomplete employee and client files. Again, most of these services are reimbursable under Medicaid, specifically Medicaid waivers. And so Medicaid has very strict requirements in terms of what needs to, and also the state, the regulatory body, what needs to be in an employee file, what needs to be in a client file at all times. In terms of employee files, keeping up with the proper training, keeping up with credentials before they expire. And so those are things that we see as a very common issue. For new providers, they often have a passion for what they do, but not a lot of business acumen there, and that's okay. Passion is what's needed because this is a vulnerable population, and they need people who care about them. But also, you know, managing the passion, implementing the program, but also keeping up with these things can be completely overwhelming, and we understand. But also lack of understanding of program policy and procedures. Um, what we're seeing is a lot of clients come to us and they get us to do everything for them, like their policies and procedures, business plans, financials. We create this, you know, awesome, business in a box for them. They submit it to the state, they get licensed. And then after that, you know, the initial inspection, doing routine inspections, or when it comes time to like implement that program, they're not following policy and procedures because they never took the time to actually read what we created for them. And so what that leads to is staff inconsistencies. It leads to quality issues within the programming. So we're pivoting on how we approach client projects, this year and beyond. We definitely want to work with providers who are passionate first and foremost. It doesn't matter about the business acumen. We can support you with that. But also understanding those program policies and procedures because they govern how you implement your program. They're very important. So the goal is to prevent corrective actions and make sure that your program is actually successful. And we also don't want you to get into Medicaid recoupments where they come and they, see deficiencies in your program, and then any reimbursements, payments that they've made to your program, they take those back. I have been a provider. I've consulted with other big providers that had multi-state programs, specifically residential. And unfortunately, I've seen quite a few things. I've actually seen providers face federal time and do federal time for issues just like this. So that's why we're very passionate about compliance here at ClearPath. And am I able to? Okay, great. So also with marketing, marketing has to start early. So even we tell providers, even when you're at the end of the licensure stage, so you've submitted your application, maybe you're waiting to hear back from the state, start promoting that program. Start letting the coordinators, the CSBs, start letting them know that you exist and that you plan on being operational. For youth behavioral health programs, you can do a lot of work with the Department of Juvenile Justice. They are looking for providers because they're going to be releasing these individuals back into the community. And so they want to support them with the services that they need, whether they're being released to a therapeutic group home or back to their home environment. They still may need intensive supports. So the goal is to create a strong referral pipeline, build connections, build relationships. The ultimate goal is to have a waiting list. With this population, yes, there is a need there, but I don't know how many of you are parents or maybe even parents of teens. But if you are, then you can identify that the needs of our teens and our youth, they vary, often, if not day by day, hour by hour, minute by minute. So with that being said, usually an ISP is built out for a whole year when you do the intake of an individual into your program, but that might not be the realistic case. That individual may start to exhibit more extreme behavioral needs and may need a more intensive environment, or may need to go back to an institutionalized environment for more programming. So it's not guaranteed that they're going to stay with you for a year or 2 years. So again, you want to make sure that you're building that strong referral pipeline, that people know about you, and that you can quickly fill those gaps, or those slots, whether you're just a community-based program or non-center based. You want to make sure that you can keep your senses at capacity. So marketing is a non-negotiable. It starts before you even open your business and it never ends. It needs to be a budget there for it, and it's just a part of operating your business.
100%. And I just want to add on, we definitely see a lot that providers never really consider it or view it as essential, but it's necessary. And I just want to give the example of you see McDonald's or Burger King. Every American, and I almost want to say every person in the world knows about McDonald's. Yet they're constantly doing ads. They're constantly having commercials. They're on the in the newspapers, they're in the magazines, they're in on the radio. They understand the importance of staying top of mind. So the same goes for any business, especially in behavioral health, and especially with this urgent population that have, again, like Ms. Muhammad said, increased needs that change and vary daily. Um, so yeah, I just wanted to add that.
Perfect. Yes. All right, so preparing for intake. So again, you want to have a workflow, you want to have a process to this, and I'll kind of go through it quickly because we're at we got about 13 more minutes. But for those of you all who can stay on, if we're not able to like wrap this up in 13 minutes, you're welcome to. But you definitely want to have a workflow to it. So you want to consider, especially as you're doing your policies and procedures, what your intake and admissions process is going to look like, your program criteria, who you're going to accept into your program, meaning the ages, the diagnoses, and who you're not going to accept. What are your exclusion criteria? You need to have that all spelled out in your admissions process, which is usually part of your program service planning. And then you also want to, during that, person-centered planning team meetings. So when you're evaluating bringing someone into your program, whether it's your facility or into your outpatient program or your community-based program, you want to really be thinking about like person-centered planning. Think about the individual. Can I actually support them and their goals and their objectives in my program? I tell providers, don't think about I'm trying to fill a bed or I'm trying to fill a slot. Think about, can I fulfill this person's goals with my program? Thinking like that, it will help you build longevity, trust, and then it pours over into so much more, your quality assurance, your risk management, all of that. Also, ISP development. Have a streamlined process for doing your ISPs. Know who's going to do it. They need to know how to do it. Also, behavior modification plans, same thing. Have a workflow. Intake forms and client welcome packages. Have those all together, making sure that they have their individual rights. They know what their rights are within your program. Also, as Faith beautifully mentioned, and that's one thing I love about her programming is that she's always thinking about her clients in every step of the process. And we encourage providers to do the same thing. As you're building out your policies and procedures, as you're doing site selection, think about the environment. Think about your population. Think about that risk management plan that you created and all the risks that you need to monitor, and make sure that environment is suitable. Don't look and just say, hey, it's affordable. Is it suitable? Again, that's going to reduce your risk for corrective actions. And then also quality insurance is so important. Have a plan on a monthly basis to incorporate and to actually have the data for how your program has been doing that month, and then that quarter, and then overall for the year. Incorporate that data and those findings into your monthly, quarterly, and yearly training. Create workflows to make sure you stay on top of those meetings. So that's what you need to do to prepare for intake. And that doesn't matter what program type you're running.
Beautiful.
So compliance happens at multiple levels. We like to break it down into 3 levels. So staff compliance, client compliance, and program compliance. So again, this is all about recoupments, avoiding them, avoiding that money being taken out of your program and facing any civil penalties, right? And so staff compliance deals with making sure staff files are complete, updated training and credentials, and making sure you have the appropriate staffing for your program type. You know, creating job descriptions and actually sticking to the qualifications when it comes to hiring. Client compliance, complete client files with the proper documentation, on-time reporting, getting those ISPs in on time, making sure your quarterly reports are in on time. Individual progress note documentation is important. And then again, program compliance, those QA plans, risk management plans, and not just having the plans, implementing the plans, and making sure that you're staying current with the changing regulations. So making sure that your policies and procedures stay up to date.
100%.
So this is where ClearPath comes in when it comes to helping you manage all of that as a provider. As I mentioned before, we work with people from various backgrounds. Sometimes there are support coordinators, or they have been directors of other programs, or they just, you know, they are nurses or come from a human service or healthcare background, and they have a passion for this population. They have a drive, they have some background knowledge, but they don't know what it is to be a provider. We love to work with people who are passionate, and we want to support you all more. So the way that we have done this is we've created our own software that's going to help you with every component of the program so that you can focus on doing what you're passionate about, but having the systems in place and workflows in place that your entire staff and team can use to make sure your program runs smoothly. So this software consists of an HR management module. You'll be able to onboard new employees, send offer letters, conduct staff training right inside of the portal. You can keep an electronic record of your staff files, and then also you can get alerts whenever any training is or certification like CPR first aid, or if you are required to have a psychiatrist in your program, whenever those credentials are expiring, you can have alerts sent directly to your inbox so that you can stay on top of the, you know, your HR management. Also, we have a module called Policy Writer Pro. This is an AI fueled tool that we have specifically programmed with our expertise, with specific state regulations, that you can literally click a button and generate compliant policies and procedures. We want to streamline the process for you as much as possible. Also, client file management. As you do new intakes, you'll be able to manage electronically all of your client files. In addition to that, you'll be able to do your client reporting. So every program or every state, and then every program type has, you know, specific templates for their ISPs, quarterly reports, and behavior modification plans. Well, we outfit the system specifically for your program type. So you can literally put some information in about that client and their progress for that month, or you can put their outcomes and goals for their year, and then you can generate ISPs and quarterly reports and behavior modification plans in minutes, not hours, so that your program directors can focus on more important parts of the program, like your quality assurance and risk management. We also have state, federal, and accreditation monitoring. So this is very important because you always want to be doing auditing of your own program. So these modules allow you to, it's basically a checklist, and you go through it. You can choose the frequency of how often you use it. We recommend once a month, where you and your quality assurance team, you go through that checklist and you check off if you're meeting that regulatory standard for the state, federal. And if you are required to have an accreditation through CHAP or the Joint Commission or CARF, those standards are in there, and you can make sure that you stay on top of that. Also, quality assurance and compliance monitoring. We have those worked into the software to where you can put your quality assurance plans in there and the system will monitor. You can go in and put in surveys, for staff, for clients, for family members, and you can monitor that quality of your program. You can literally print out reports and use them during your quality assurance meetings and compliance meetings. And then we have customized workflows. So if you're looking to develop specific SOPs for your business, you have specific processes, you're able to develop those workflows and send out tasks and reminders to various staff. And last but not least, we also have a full marketing suite. So the goal is to make this a holistic support for your business. Again, marketing is so important. So we have it to where you can go in and generate a logo in minutes. You can generate code for a website. You can generate a flyer, brochure, business cards for your business in minutes. And that's all included in the suite. And we are building out, we hope to have that up and running within the next 3 months, but we're building out to where every provider in every state, there'll be a CRM. So you'll be able to see all of the case managers, social workers, support coordinators in that state and create customized email campaigns that will come from your business. And you can, have their contact information and reach out directly. That way, again, you stay top of mind and relevant and build that referral pipeline.
Awesome. Thank you so much, Ms. Mohammed. We're
Absolutely.
super excited about Mountain View Compliance. Again, this is built off of all of our expertise here at ClearPath, and this is essentially what you need to run your business and stay compliant in one platform. So it's something we're definitely excited about. So I know that we've talked about a lot today, all the different aspects of running the business, the regulations, the different requirements. So we want to let providers know that you're not alone in this process. At ClearPath, we do it every day. We've done it for over 40 years. We can assist you with every step of the way, whether that be developing your program, developing your policies and procedures, whether that be helping you with the other documents with licensure, like the budget, business plan. We'll help you with staffing. We also have a program, ClearPath Connect, where we help providers find staff. We also will help you with your applications. We can submit them for you. We can help you through that process, help you with the inspections. And we also do referral marketing. So again, we're really gung-ho about marketing your program. So we assist with that. We do calls, we do logos, brochures for our clients. We do it all. And then compliance. So you're not alone. We can assist you if you need assistance. And we do it. Right now, we're offering 2 ways to work with ClearPath. So if you're interested in opening a new youth program or a new program in the United States, we can help you with developing your new child and adolescent program and getting licensed for it. And we have 2 ways to work with us. So one is a very exciting new opportunity that we're offering for providers, and it's called the Do-It-Yourself Intensive Cohort. And so we also have that, and we have the Done For You program development, which is our standard where we'll do your program, we'll write all of your policies, and it's done for you. So there's 2 different ways if you are seeking that assistance with getting licensed. So the do-it-yourself cohort is something new that we brought out. And we did it because of what Ms. Mohammed said a little bit earlier about that we're finding a lot of providers who are getting licensed, but they have no idea what's in their policies and procedures. They need a little bit more guidance on what it means to actually be a provider, how to stay compliant. And people may be interested or familiar with the space, whether it be support coordinators, social workers, case management, existing providers that work in different populations. It's designed for people who want to learn themselves how to get licensed, who want to learn how to develop their own policies with that guiding expertise. So we do it in a cohort. It's limited to 25 providers, and it's an 8-week structured program. So in the program, you're learning the fundamentals of how to write your policies and procedures. We're doing it as a group. We're learning how to set up your business, structure it, do your LLC. I know a lot of providers are aware of that, but this is for new providers as well. How to develop your program. And we're helping you do that every step of the way with guidance. But it is a do-it-yourself intensive. So you will have to do some assignments, and it features weekly meetings and guided support. So you'll learn how to write your policies and how to run your program as a business owner and provider. This is application based. So we are accepting applications. And so we're really looking for providers who are not only passionate, but they're willing to put in the work. So you want to learn. You want to learn how to do it. You want to learn about your population. You want to learn how to be compliant. And you just don't want someone to do it for you. You want that guidance. But you want to learn how to do it yourself. So we're seeking those types of providers who are willing to learn, who are willing to do the work, and participate actively. So this cohort is limited to 25 providers, and we're already seeing a lot of response and excitement towards it. So we're happy. Again, some more information about this cohort. It begins February 24th. So this is all that you'll learn and build. So you'll again get some business registration assistance. You'll also feature full use of Mountain View compliance for a year. You'll fully develop your policies and procedures manual for your new business and your new company with a guided support, of course. And then you'll do your QA and risk management plan. You'll have your business plan, your marketed plan. You're also some 2-year financial projections for your company. It also includes a premium marketing kit. So you'll have your website, your brochure, your business cards, your flyer. So you can start marketing your program and hit the ground running as soon as you get licensed. And so you also will get access to dedicated consultants that will provide you guidance during our weekly sessions. And we understand the needs. We understand what's required to get licensed. So we know how to help you and give you that oversight along the way. And again, it features 2 weekly meetings, and they're in the evening time, 7 p.m. And it's an 8-week cohort. For this cohort, it's 4,500 for early bird pricing. That early bird pricing ends on February the 7th, so about a little over a week from now. So you can secure that early bird pricing, and after February 7th, excuse me, it returns to $5,000, which is the regular pricing. So if you're excited, you want to learn how to do your policies, you want to learn how to run your business, but you don't just want to be thrown out to the wolves, you want some expert guidance and oversight, this is the perfect opportunity for you. So social workers, support coordinators, existing providers, anybody who wants to learn, this is for you, and we have it available. And so, of course, we have the standard done for you program development, of course. And this includes full policy and procedure development. So we'll do all the documents necessary for you to get licensed and run effectively. Again, that includes your business plan, your financials, your marketing plan. We'll do a 5-page website for you, including your brochure, your logos, and your business cards. This also includes 3 months of marketing via our sister company, CCJM Solutions. Um, so essentially, a business in a box is what we look to provide. And this package includes 3 30-minute meetings with your consultant. So on those meetings, you'll be talking about the service you want to run. You'll get kind of clear on the direction, and then your consultant will begin your project. And so the turnaround time for this is about 60 days right now. Our caseload is kind of full. So in 60 days, we'll have you ready for licensure. And the regular pricing is 25,000, but the special pricing we're offering is 12,500. Excuse me. And again, just the do-it-yourself cohort, we got that early bird pricing to register for the cohort, secure your slot and apply. That would be 4,500. And again, both of these pricings end on February the 7th. Now, Miss Mohammed, I know I just said a lot. I know we're running out of time. Did you want to add anything to that?
Okay, let me get off of mute. Yeah, I just wanted to say that I'm really excited about the do-it-yourself cohort. I think that it's going to be beneficial for providers. Like I said, it's really, it it's really great opportunity first and foremost for me as a consultant to know that providers understand how to run their program, understand policies and procedures. And every week, I will be there with you. I know Faith will be there with you and a few other consultants from our company. And we will be breaking down each and every regulation that applies to your business, giving you all the information to build the policy and procedure effectively. And as I mentioned, you'll have full access to Mountain View compliance. So you can literally click a button and generate that policy and procedure. But before we get there, we're going to be doing those sessions with you so you actually understand what that regulation requires so that when you look at that policy and procedure, you understand why it exists and how it is to be implemented within your program. So I'm very excited about that piece because understanding is key. It's very discouraging when we have providers and they're licensed and they come back and they ask us how to do certain parts of their program. And we ask like, have you reviewed your policy manual? And they never really even reviewed the policy manual that we made for them. So I'm excited about that. And I just want you to know that we have developed this do-it-yourself module. Even though it says do it yourself, you're going to be guided every step of the way. So not only are you going to be doing these things, but you'll have the tool, Mountain View compliance, to really make it easy for you to do it. But the goal of the actual live sessions that we'll be doing twice a week is to understand the why and how to implement it within your program. So we're really excited about this and also to make it as cost effective for new providers as possible.
Yes. 100%. Yes, we definitely want to make it easily accessible because we see the need for this guiding. So we're really excited about that. I know we went a little bit over time. So this is just the schedule for the do-it-yourself cohort. So today, applications open. So on the application, we're really seeking for providers who are passionate, willing to do the work, and be dedicated to the 8-week program. So you submit your application starting today. On February 7th, early bird pricing ends. So that $4,500 to get in the cohort, that will end on February the 7th. February 20th is the application deadline. So if you want to submit your application, it will end on that date. And then on February the 24th, the cohort begins, which is super exciting. And then April the 16th is the last session of the cohort. And our goal for you is at the end of this cohort, new and existing providers will have all the tools and skills necessary to successfully apply for their program, understanding their policies, knowing how to write them. So you're skill building. And also we do have that Policy Writer Pro module in the Mountain View Compliance, which you're going to be learning along the way. And so now through this structure, we're helping you not only become providers, but competent, capable business owners. So we're super excited about that. And you won't be alone. You'll have a cohort of other students who are there. So not only are you getting that skill building, you're getting that guided expertise, you're also getting a community of people who are wanting to do the same thing. So that's it about the cohort. I know we ran over time, but we do still have some people in here. If you have some questions about what we spoke about today, whether it be youth programs, whether it be the cohort, whether it be the do-it-yourself option, we're happy to answer for them. We can answer a few questions.
So I have this MNK again. I have a question on staffing
Mhm.
because that seems to be one of the biggest challenges. Like I have a requirement, a need for an OT, occupational therapist right now, but I can't seem to assess like where do I access this information? So do you guys provide all those like ability to, identify and, contact all the staffing issue?
Sorry, had to get off mute. So that's a great question. So in regards to staffing, what we do right now, we do have a program and it's called ClearPath Connect, where if you are in need of staff, you tell us what state, and we work with our sister company, CCJM Solutions, which is a certified marketing agency, and they will get all the data for occupational therapists or speech therapists in your service area, and they will do targeted outreach. So they'll do like a job campaign and send the job description out to try to source staff for your needs. And I can send you some information about that program with pricing after this call. Once you get
That
your,
would be great. Thank
yes,
you.
absolutely, you're welcome.
Yes, were there any other questions from anyone?
Yes, my name is Gerald. My question is, after now, do you have program that you allow people to maybe free, like a free consultancy services where we can ask more questions before we be able to invest or put our money on this because we may have to get certain clarification before we make any payment. So, what you just provided is, the opportunity, the investment opportunities and, in this area, but we may want to ask some private questions in relation to our individual, plan. Do you have such free consulting services, maybe for 30 minutes or 15 minutes after today's section?
Yes, so we do offer free consultations. They are 15 minutes. Within that time, we can kind of identify what you need, really get clear on how we can support you. We can give you some pricing. So we do have that 15-minute consultation option. Now, if you wanted advanced support, maybe up to like an hour, we do have options to pay for operational support. So that's when we'll really give you that one-on-one support to help guide you, which would be a lower cost. It's a per hour cost versus going right in and investing. Um, so I hope that answers your question. Excuse me. All right, I know we're getting we've way past time, but
Sorry, Faith. Do you mind
yeah,
if I just add a little bit with the
yeah.
15-minute support time? Just want you to give a heads up. Anyone that books that, please, because it's only 15 minutes and we need to maximize time. Usually once you book, we'll have someone call you and get the specifics on what we're going to discuss so we can have like all the information for you. Reserve that for if you just have question about one state and one particular program type. That way we can have this, the definition of that service. We can tell you about the licensure process, and then we can cover like the current reimbursement rates. Those are what we generally do for the 15-minute. Now, if you are exploring like, oh, what state should I open in? If you want to know about multiple states and multiple programs, that's when you're going to need to book that 1 hour time for us because it's a lot to cover for us. And that's a lot of time and preparation on our end. And thank you. I did receive your email. I'll go ahead and note that now.
Great. So if there's no other questions, I'll give just a few more minutes for any other questions people may have. And feel free to drop them in the chat. All right. So this are the next steps if you are ready to move forward. So if you are looking to apply for the cohort, you can easily find the application at clearpathconsultinggroup.com/cohort application. When you go on there, you'll see the application. It'll have some additional information about the cohort, which you'll be learning each week, just so you can really wrap your mind around what that program entails. Or you can book a free 15-minute consultation if you're looking for a done-for-you package. We're happy to do that. Again, like Ms. Muhammad said, typically after you book a consultation, we'll have someone call, we'll gather information, and then on the call, it'll be very clear, directive. We'll figure out a way forward. So I just want to thank everyone for joining us today. I had a lovely time discussing, again, child and adolescent programs is something that I'm super passionate about. Here at ClearPath, Ms. Muhammad as well, we're super passionate about consulting and helping providers. So we hope that we provided you some value today. If you have any further questions, you can shoot us an email at hello@ClearPath Consulting Group. We'll try to get back to you within that business day, typically within 2 hours. But you all have a blessed day and thank you for joining us. You can be on the lookout to your email. We'll upload the webinar replay. So if you weren't here in the beginning, you joined a little bit late, or you want to replay some certain sections, we'll have that readily available for you. But without further ado, thank you for joining us.